All right. Dr. Rogers, we are live. Shannon, I saw you come in. Do you want to do a roll call and just make sure we have a quorum? It looks like we do, but we probably should say it out loud since we are doing it by Zoom. Let me see. I got to turn my volume off on my YouTube. There we go.
Okay, I have Barry Smith.
Here.
Jerome Dixon. Marlene Richardson. Philip Hayes.
Here.
Dan Durham.
Dan's here.
Arthur Haley. Gail Phillips. Jay Eastridge.
Here.
Thomas Rogers.
Here.
Lisa Halliday.
Here.
David Hessen.
Here.
Greg Tungett. I think he told me he probably may not be able to join.
I think he's here.
Okay.
I see Greg Tungate in the list.
He's here. I can see him.
Gotcha. I have 8 that said here.
Marlene just checked in too. So
And Dr. Haley's here. He's just muted.
Okay.
all right, that makes a quorum, right?
I think so.
All right, so it would be up to you, Chair, to call the meeting to order.
Okay, we'll go ahead and call the meeting to order. Since we are doing this in this format, I'm going to turn it over to Sean to pretty much lead this through the agenda. We have a few new things in public health since our last meeting that we're going to need to talk about. And so, Sean, I'm going to go ahead and turn it over to you at this point.
All right. So if any of you guys have COVID related questions, we'll save those to the end during the director's report. The first item on the agenda is the approval of the meeting minutes. I'm going to share my screen. Do you all see the minutes on the screen?
Yes.
Okay. So, or the agenda. So the minutes were sent out to everyone along with the entire packet, and you should have been able to review these ahead of time. So, Chair, if there's no questions, if you want to call for a motion to accept the minutes.
We need a motion to approve the minutes.
I so move.
I'll
And
second.
we need a second.
I'll second the motion. Judge Smith.
Okay. All in favor, say aye.
Aye.
Any opposed?
Aye.
Motion carries.
All right. It looks like Gail Phillips is just getting ready to join us too. The next item on the agenda, Chair, is the health education report. Tracy, are you going to give that, or do you have someone else lined up to give that?
I'm here and I'm going to give that, Sean.
Okay, so I'll go ahead and share my screen. You can tell me if I'm showing the right thing.
Okay, I'm going to be brief. I wanted to let you all know that we have completed our 2020 Community Health Assessment booklet, and that is on the website, on the Lake Cumberland District Health Department's website under Health Assessment. In your package, you're going to have some data pieces that we shared with all local boards of health, just comparing 2011, 15, and 20 data from County Health Ranking. We use this data to guide our programs and to help us when we do our Community Health Improvement Plan. Our plans are to begin working on our community health improvement after the pandemic, when we have enough time and when we're meeting with our community members. I do want to say, as I look and you all look through the data pieces, you'll see that Taylor County in 2020 with County Health Ranking, with 2011, looks like our health outcomes were a little bit better, but each year County Health Ranking adds data points. So really Taylor County is doing pretty good when we look across our district and compared to the state with our health outcomes. With our health behaviors, again, they're doing quite well. We particularly look at tobacco, adult smoking, and we have went down there. Adult obesity and physical inactivity continue to be a little high for us in our communities, and those are really hard markers to change. Our teen birth rates have went down in Taylor County somewhat. Our overdoses have went down. It looks like excessive drinking for adults has increased a little bit in Taylor County. When we think about the health behaviors or health factors across our communities, I can't help but stop and think about our children or some of that data. So when we look at children in poverty, actually Taylor County has went down somewhat for children being in poverty, but children in single parent homes has increased in Taylor County. Children in foster care, we don't have any comparison data for 2015, but that's still a large number of children there. Grandparents raising grandchildren, incarcerated parents is still a concerning issue. Most of those are concerning issues. So when we think about our programs in our community, we want to continue our work educating the community and advocating and helping people be aware of adverse childhood experiences, because those factors really impact the health behaviors and health outcomes of our citizens. So that is one avenue that we're going to continue to move forward with when we go back to, I guess, real life in a sense. That is my short overview. If you have questions for me about the data, please ask, but you can find all kinds of data on our website regarding Taylor County compared to the district or the 10 counties.
And I don't know if I was showing what you wanted shown at the, when you was presenting it, but all these sheets that I'm scrolling through right now, they are in your packet. I guess this draws out the items from the first sheet. This draws out what you're wanting to highlight, right?
Yes, sir, it does. I'm sorry, I went through it pretty quick, didn't I?
No, that's okay. I just didn't know,
Yes.
but it is available and everyone has that to review. So, all right. Does anyone have any questions for Tracy?
This is Dr. Dixon. I just had one real quick question. Let me find it when I was reviewing this. On some of these numbers, when it was calling, where was it, healthcare providers and mental health providers, is that it said that, am I reading this right when it says primary care providers in Taylor County, there's one for every 1,500 residents, is that correct?
Yes, sir, that is correct.
And when they say primary care physicians, are they talking about physicians, or are they throwing nurse practitioners in the mix with that as well?
That does not include nurse practitioners.
Okay. And then the other question on the same thing, when it says mental health providers, what was the definition of mental health providers there?
Let me pull that up for you just 1 second. I've got a bunch of papers here in front of me.
Because I seem to have a hard time getting people into mental health providers, and that just seemed like a really high number of mental health providers in Taylor County when there's one for every 480. So I questioned what the definition of mental health providers was.
Well, she's looking that up. All of this comes from the county health rankings. They have a website. You can search county health rankings, and you can go to your county or your state, and then you can drill down to the county. And it's got the for every item they have, it's got definitions with it. So you can go to the
Just
county
froze
health
up.
rankings website, see how they've defined all of those.
Yes.
Okay.
And it just talks about mental health providers is what it says here, the ratio. I didn't pull out the specific definition for that. And I'm sorry, I'm having a little trouble hearing you. It's probably on my end, and I apologize for that. But I'm sure there's a definition. I'll dig a little bit deeper, and I'll come back and answer your question, okay?
Yeah. Tracy, if you don't find it, you can always email him afterwards. But if you do find it, feel free to just jump in and give us the answer, okay?
Okay, I'll probably put it in the chat.
Okay. You may want to tell us it's in the chat. I may overlook it. I'm watching 3 screens right now. Any more questions for Tracy and the reports from the county health rankings? Sheriff, it's all right. We'll go on to old business. We were going to have an update from the Trail Town grant that we awarded last time. Is the person who's going to present about that available?
I have actually emailed them a couple of times and sent the new link. I'm not sure. I called also, so I'll check in with them again, Sean.
Okay, maybe we can swing back to that in a minute, and
That sounds good.
if not, we'll do the best we can to give the report that they've provided. But I would rather them give their own report. Let's see. No, I think they're jumping in right now. So let's give them just a second. As we're waiting on that, is there any other items of old business anyone wants to bring up? Anything that we didn't cover adequately since the last meeting, or? All right.
Well, during this meeting, I didn't see it on our agenda. Were we going to just do a summary of COVID in the county as well?
Yes, I'll do that during my executive director's report toward the end.
Okay.
If that's all right.
Thank you.
All right. I think we have the folks from Trail Town that just joined us, and if so, we're to the point in our meeting where you guys can give an update. Are you available? I see that their camera is on, but I don't see. Yes, they're getting their microphone hooked up now. If you can hear us, I see Dave and Suzanne on the call. You're still muted, so if you're talking, you'll have to unmute. Dave, Suzanne, are you there? I see you're unmuted, but I don't hear you. Okay. Tracy, maybe you can text them or call them and see what their technical issue is. For now, we'll move on. We'll swing back to that. Under items of new business, we have the setting the tax rate and approving the budget. And since part of what will be in the budget is a Trail Town proposal, let me skip over the tax rate and the budget and go on to the audit report for a moment, if I can, Dr. Rogers. That'll give us a little time. Would that be okay?
That's fine by me.
All right. I'm going to find that in my packet, and then I'll put it on the screen so everyone can see it. All right, I'm going to share my screen. Do you see the Taylor County Public Health Taxing District financial statement? That's the audit report. You see that, Dr. Rogers?
I do.
Okay. All right. So as far as the audit goes, it's in the packet in its entirety. The things that I usually point out when I'm giving it in a summary is there's two statements here in the introduction of the audit reports. One is auditors always give an opinion about our accounting principles that we use. And what that means is the health departments in the state use a cash accounting procedure as opposed to an accrual accounting procedure. We do that because that's what law prescribes for us to do. So we're doing what state law requires. However, most businesses use accrual accounting. So all the auditors always make a statement that we don't use the generally accepted accounting principle, but we do use what's required by law. So right below that, though, they do put an unmodified opinion saying that the financial statements do present fairly in all material respects our assets and liabilities and fund balances. So in other words, it's a clean audit. They felt like our numbers reflected appropriately what our account balances are and that we've used the money correctly and so forth. So I won't go through that in detail. You all have that and have probably already reviewed it. And if you haven't, I'm sure you will after. So Chair, that is a audit report, and that is something we need a motion and a second, and that we need that approved.
We need a motion to approve the audit report.
Dan, I'll make
Oh.
that motion.
And Jerome Dixon, I'll second it.
Okay.
So I
I
think
think
Dan,
Dr. Haley made the motion and Dr. Dixon seconded the
Okay.
motion.
Okay.
All in favor, say aye.
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 Any opposed? Motion carries.
all right. Are the folks from the Trail Town update, is your technology working now? I see their microphone is on, but I'm not hearing anything. Okay. Tracy, have you had a chance to reach out to them to see? They might want to, Tracy, have you got the dial-in number to this meeting? They might want to dial in case.
Yeah, Tracy, let them know that they can back out of the audio that they're in now, and when they rejoin, it'll ask them if they want to join by phone, and then it'll give them the number to dial in and the code to get in, and then they can just use a phone.
Okay. Chair, if it's all right, I'll go on to terms that
Hey,
expire.
Sean,
Yes,
can
yes.
you all hear them now? They're trying to join in by,
Are they
still
speak-
nothing. Okay, they're gonna call in.
Okay. Chair, for interest of time, we'll go, if it's okay, we'll go to terms that expire and election of officers and district members and get that out of the way.
Please do.
Okay. I won't need to share my screen for this. What I have listed as far as board members whose terms expire, the ones that will expire at the end of the current year, 21, are Gail Phillips, Marlene Richardson, Jerome Dixon, Jay Estridge, David Hessen, and Dr. Thomas Rogers. I think that probably matches your list, doesn't it, Shannon? Shannon, you're muted. She's trying to unmute.
Sorry. Yes, that is correct.
All right. So as long as you guys are willing to continue to serve, generally at this point in time, we would go ahead and have you fill out a bio that we could submit to the state. The state Cabinet for Health and Families, the Department of Public Health appoints the board members other than the judge and the fiscal court appointee. But this year they've changed their process, and we're going to have to submit your names through an electronic form on their website. So unless you guys tell me you don't want to serve anymore, so at some point during this year, we will re-nominate you to serve again next year. Is there any of you guys that are wanting to step down from serving on the Taylor County Health Board?
No, my camera's not working for some reason, so I'll just unmute.
Thank you, Dr. Phillips. Well, if I'm not hearing you say no, I'm taking that as a yes, and I'm gonna resubmit your names, or I'll have Shannon enter that here after we finish all the board meeting. As far as the officers on your board, I serve as the secretary for the boards. Otherwise, the chair is Dr. Rogers, and the vice chair, if my notes are correct, is Marlene Richardson, and that's your slate of officers.
So Sean, we need a nomination for those positions. Is that correct?
Yes, if everyone's happy serving and everyone's happy with the service, someone could make a motion to keep the officers, or if you want to nominate someone else, this would be the time to do it.
I'll nominate to keep our officers as duly appointed, and as long as they will accept the nomination.
That was Dr. Dixon.
I'll second that.
That was Gail, I think, that seconded it.
That was me, Gail.
Dr. Phillips, thank you. Any,
I guess we need to vote on that, Sean.
yes, sir.
So all in favor, say aye.
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 Any
Aye.
opposed? Motion carries.
Thank you. Congratulations again on your reappointment as chair, Dr. Rogers. You do a
Thank you.
fine job. Those who serve on the district board, of course, you know, there's a governing board that representatives from the county board serve on the district or governing board. It's a 30-member board based on the county's population size, your membership. All of the judge executives are automatically on the district board. In your case, in Taylor County, with your population size, you get 2 additional members. You get 1 member for every 15,000 or a piece of 15,000. So your population size entitles you to 2 more members. Dr. Gail Phillips is serving as an additional member, and Marlene Richardson is serving as your additional member. Right now, our district board, we're meeting by way of Zoom, which removes some of the travel burden. Of course, Zoom meetings aren't quite as good as in-person meetings for the interaction, but with COVID, it's what we have. So.
So Marlene and Gail, are you all willing to serve again in that capacity?
Yes.
Yes.
Gail, yes.
It's Marlene, yes.
Okay. So
Moved it.
we need
I
a
moved it.
motion in that. Unless somebody has any other discussion, we need a motion for that.
I'll make
moved
that
it.
motion. Go ahead, Jake.
I'll second.
All right, that'll work.
Jay seconded. Who was the motion?
Judge Smith.
Judge Smith motioned and Jay Eastridge seconded.
So all in favor, say aye.
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 Sorry, any opposed? Motion carries. Thank you all very much for your service.
Let's see if we can circle back to Trail Town and see if they've got their technology lined out.
I don't think they do yet, Sean. They're trying to call in.
Did they have the call-in number?
I gave that to them, yes.
Okay. All righty. Well, I can give my executive director's report and we'll give them a little more time to see if they can line it out. Is that all right? Otherwise,
Go ahead.
we'll just have to
Please do.
print. All right. So since March, my life and most of the staff at the health department's life has been pretty much COVID-19. Our jobs have evolved. You know, we as the health department, we do disease investigation, we do isolation and quarantine. In our environmental division, we do enforcement. You know, in our health education, we do public health messaging. I mean, this is all stuff we do. The challenge has been that this is a lot bigger of a challenge than most challenges we face, and it's lasted a lot longer. Most of what we do in public health is, you know, pretty well broadly accepted. When we, you know, if we find out there's a restaurant that's having an infestation, most people in the public agrees that that doesn't need to happen. And when we deal with that, the public's behind us. And if someone's straight lining into a river or a creek or the lake, most people agree that shouldn't happen. And when we enforce upon that, everyone's pretty much behind us. But, you know, with COVID-19 trying to enforce the restrictions and the regulations and things, it's been about a half and half of people thinking we're doing too much or people thinking we're not doing enough. So it's been that part's been tough. That part has paled in comparison, though, to how tough it has been dealing with the shortage of vaccine and the frustration that people feel when they can't call in and get an appointment. As a society, we're I see Dr. Richardson saying, help, we need the vaccine. I agree. As a society, I think we've become accustomed with vaccines that they're widely available and a lot of providers have it and they just call in and get an appointment and get it. This is the first time in my lifetime that we've had a pandemic and the vaccine has been just developed and is just being manufactured and it's just being pushed out and it's not plentiful. You know, the state was getting 55,000 doses a week to spread out across 4 million people, 4.5 million people. And that's trickling into our district. And it's it's a real challenge. There's a lot of providers in our district willing to be a provider. It's just there's not a lot of vaccine to go around. As much as people are frustrated, it's actually gone a lot better than what you might think. I mean, we had our first case in March. We're not even a year into this yet. A vaccine's already been developed. You know, the nursing homes have already had at least their first dose, and some of them their second dose. The medical providers and hospital staff that signed up for the first round, they got their doses. School staff have had their doses. First responders have had their doses, and we're probably halfway through the 70 and older population. The 70 and older population represents 50% of our deaths and 75% of our hospitalizations. So that's an important market to get through. And if we can get through that market in the next 6 or 7 weeks, we will have done a lot. I would hope that after the 70 and older, we would go to 60 and older, but that's not going to be my call. The 1C group includes almost everyone. And I don't know if the state will continue to just open it wide open after the 70 and older, or if they will try to do something a little more focused, but we'll have to wait and see what the judgment is on that. As far as the disease itself, over the last 4 weeks, with the exception of this last week, we've been trending down as far as new cases. From a district perspective, we've been trending downward. This last week, we had a little bit, we ended the week with more than the previous week, but for the first 2 days of this week, we're less than the first 2 days of last week. So we have been going down, or at least we've plateaued, probably going down. And we hope that continues. It's probably a combination of the diseases running its course, that we've had about 20 something percent of our population that's been a confirmed case, and now we're getting the vaccine out too. So a combination of some natural immunity and the vaccine immunity is hopefully slowing it down, and a combination of people taking this serious and trying to avoid crowds and so forth, all that together. So it's been difficult. Right now, the biggest challenge, we got 4,000 doses of vaccine in. Well, a week or two ago, we got 700 doses in, and we were able to schedule all 700 appointments in 2.5 hours. And we were able to administer all that vaccine within 2 days of scheduling the appointments. So we moved that very efficiently, and we got the appointments scheduled very efficiently. But during that 2.5 hours, we had 110,000 attempted dial-ins to our phones. And unless you're Ticketmaster, you're only equipped to handle so much, and all this is the hospitals that are hubs. And when the pharmacies start getting some, everyone's going to experience this same phenomenon, that your technology, as far as your phone or scheduling system and the number of staff you have, you can only do what you can do. And, to have scheduled that many doses in 2.5 hours and gotten them administered within 2 days was amazing.
You're welcome. All you need to do is just mute your thing until it's time for you to talk.
Okay.
It sounds like they're getting ready to go. We got 4,000 doses that's going to be coming into our district and spread out over the next 3 weeks. Yesterday, we scheduled 3,113 of those appointments. And this morning, we've scheduled most of the rest of them. We should by the end of the day. Now, we did have a glitch this morning. Spectrum, our internet and phone service provider, went down. And to complicate an already frustrating situation, we had to reroute our phone calls and push them out instead of using a call center where we had 30 phone lines and 20 operators, we had to roll it out straight to the clinics and let the clinic clerical staff try to schedule them, which the best I can tell, they've done a great job with an unexpected well of a burden dropped on them at the very last moment. So Shannon, I know this morning when I talked to her about the board meeting, sounded like it was exploding. And I've already sent them a note how much I appreciate them picking that up. That was unexpected. But that's going to make people frustrated because it's not going like we advertised. But we are getting the appointments scheduled. We'll get those vaccines administered over the next 4 weeks as they come in. And, we'll do good. So anyway, what do you guys want to ask me about the situation?
Hey, Sean.
Yes, sir.
I'm just going. I know they probably have questions, but I just want to interrupt. I think that Dave and Suzanne now are able to speak whenever they're done with all their questions.
All right, thank you. All right, so I'm ready to, anyone that the board members that want to ask a COVID question, feel free. Or about anything else.
I don't have a question, but I want to say kudos to you guys. You guys have done a wonderful job, and I agree with you. I mean, I think under the circumstances, I think we vaccinated a huge amount of the at-risk population, and we're, in another couple of weeks, I think we'll have the majority of the at-risk population vaccinated that really need vaccinated, and then the rest of it is, in my mind, just kind of icing on the cake.
Yeah, if we can get to 60 and older, that, I think I maybe said this, that represents 75% of our hospitalizations or deaths and almost 9% of our hospitalizations. So if you can get through the 60-year-olds after the 70-year-olds, you've really, as far as public health impact, you've made a tremendous punch. Just getting through the nursing homes in the 70 and older is major.
Don, I would like to second what Dr. Dixon said. I think that our staff here has done an excellent job. I've had numerous patients that have complimented them on how easy it was to get in and out, getting the vaccines, and they thought it was a very efficient process. And certainly throughout the whole thing, since March of last year, I think that the health department's done a very good job.
Yeah. Well, I have about 20 people a day call me a moron, or that, and that's the polite interpretation of the conversations I have, because people want the vaccine and they've sat on the phone for 2 hours, they couldn't get through. They don't understand that you can't make 4,000 doses spread across 10,000 people. They don't understand that their loved one, who is the most important thing in the world to them, is one person among a high-risk population of 10,000, folks in group 1A and 1B are 10 or 15,000 people, and I can't prioritize, anyone over someone else. And, everyone's story is desperate, and I sympathize with that, but I just can't make more vaccine than there is. We've really tried to do our best, but it's tough some days.
I do have one question. If we have a first responder that missed the first group, how do we get them moved up on the list if they need to be on that list, and because they are first responders? Because I have had a couple of people that fit that bill, but they don't know how to get on the list, or can they even get moved up the list?
There's no lists anymore for first responders or teachers or there was a time when everything that we had was being pushed only to medical staff and first responders. And then there was a time when most of what we had was being pushed toward the teachers. But that time of special treatment has passed. And right now, anyone in group 1A or 1B is welcome to try to schedule an appointment, but you're not being given special priority. It's just you're competing with everybody else that's in 1A and 1B. We should, though, over the next 6 weeks, be able to get through, most of the 1A and the 1B that wants it, providing vaccine continues to come in to our district at the rate it's been coming in. We've not been promised more doses of vaccine in the health department other than the 3-week 4,000 push. I know the state wants to continue to push it to us if the supply's there. I know there's, several vaccines we've posted on several pharmacies we've posted on our website that'll be getting a small push each week, probably 100 doses. I know Lake Cumberland Regional is still going to be getting 500. I know there's a couple more regional hubs that's in development that should roll out in the next few weeks. So, it will get better. So it's just a matter of, can we just hang on for a few more weeks without losing our minds? I wish I had a better answer for everyone that asks me these hard questions. Anyone else? Other than that, my staff have done remarkably well. I've moved every employee in the agency, regardless of what you were hired for, into some version of this response. And basically, they've done really well. I mean, they've worked some really long hours, nights, weekends, holidays, and you know, it's amazing that they've held on as long as they've held on. Now we try to rotate our staff so nobody's overwhelmed too much, but there's a few of us that there's a lot of pressure, and so far we've held on, and the staff have held on, and they know they're doing important work right now, and we sure appreciate them. Okay, so I think Trail Town's back up. Judge, do we want to go back up under the old business and get our Trail Town report?
Please.
All right. Are you guys from Trail Town? Are you back in business? Are you in business?
We're here in present.
Hey, great to have you all. I'm going to try to pull up your part of the report here and put it on the screen. You can, if you want me to scroll or something, just tell me where you want me to go to, okay? So on the screen right now, you should be seeing, it says to the Taylor County Board from Trail Town, and it's dated January 25th, 21. As I scroll down, I've got some, if you can you see it?
Yes.
Okay, am I where you want to be?
Yes, that's fine. If everyone's read over the proposal, does anyone have any questions? Or are people seeing it for the first time right now?
Well, how are we doing with what we did last year?
What do you mean? Are you
I mean, just as far as an update on the progress from the things we approved.
Okay, well, that is in regards to the map that was sent. So if you want to switch gears, that's fine. But Dave's report from last year applies specifically to the easement that's related to the health department and the trail proposed through that area. So thank you for pulling that up. And Dave will speak now specifically to that and any questions you might have.
Yeah, the last time we met with the board, you did agree to allow us an easement for a trail project across the health department's property, but the route was not specified at that time, and it wasn't really designed at that time. On the map that you have in front of you, I think the route that is either purple or blue, I call it blue, is the proposed route across your property, coming off the health department property. Now, I mean the hospital property. Now, one thing I want to emphasize about the route coming across the hospital property, it's not completely finalized. They have agreed that we can follow their property line, as you see, that goes behind the lots that they are selling off. But as you know, the back area of their development is not yet planned, and the current board does not want to make decisions about how our requested easement route will be used until the new board, the new hospital board, takes office, because they will be the ones that will be dealing with the development of the back portion. I don't have any reason to doubt that the hospital will help us. They've been very gracious and helpful in everything that we've asked, but we just have to patiently wait for their next board to deal with the development issues on that back lot, which will include our easement across into Tom Gupton's property. Now, of course, Tom Gupton is also asking for an easement, so he and we are just a little bit in limbo for the moment on that. But I don't right now have any reason to doubt that we're going to eventually be able to follow the route that you see outlined in blue. And so what we're asking today is that you agree to the specific route that we are proposing across your property. Now, as you can see, it basically follows that copse of trees, the wooded area along the fence line, so that it doesn't encroach any more than necessary into the grassy area of your all's property. and our anticipation now is that this would be an 8-foot wide, for at least for the time being, a DGA trail, dense grade aggregate rather than asphalt, just simply for reasons of economy, that would come across from the hospital property, across Tom Gupton onto your property. We'd have to put in probably a tile there coming onto your property, and there may be a tile that we'd have to place somewhere on close to the DOT right away. But that would be our responsibility. So we're asking for approval of that specific route. And I believe that our request also was a request for some financial help. We were obviously, there's no city budget for this. We're doing it as best we can with the resources that we can scrape together. And if the board can help us with that, that would be very much appreciated.
How about we approve the easement first, and then we'll look at the financial proposal? Would that be okay?
I agree. I agree that would be the best way to do it.
Dr. Rogers, I've tried to show my mouse here where this is our building. You know, this is coming from town around, this goes back around by the hospital. I don't know if you can see my mouse moving, but this is our property, and the easement would go along the edge and along the trees and down that way.
So is there any discussion amongst the board members regarding that?
From a public health perspective, this is Sean. I mean, having a walking trail tied into the health department supports their mission. So
I think we've already approved this in years past. I think we're just reaffirming that that's okay.
Yeah, they've got the specific route here laid out now, right, so you can see. So as long as you all are okay with that, I guess since you've already approved it, unless someone has opposition, they can go forward.
So we need a motion to approve that unless there's any other discussion.
This is Dan. I'll make that motion.
I'm sorry. Go ahead.
What did you say, Frank?
I was just going to add one comment. This is Dave. Just so you know, and maybe we've discussed this before, but this route will, the plan is that it's going to come, we lost the map, but that it will come down through Miller Park. There are soon going to be, we're now looking for bids from contractors to build a 24-inch pipeline from the water treatment plant down to a holding tank down by the trail on the other side of the highway, 327, 527, whatever it is. And that route will follow Miller Park Drive, and it will, when it is completed, it will be an 8-foot wide DGA surface to use as a trail. So the trail that we're talking to you about on your property will eventually come down through the DOT property and connect with that soon to be constructed trail through Miller Park and back to Lebanon Avenue. So once those legs are finished, there will be a complete route. I don't know that anybody's calculated the mileage or the footage yet on that, but as you can see, it'll be a very extensive loop that will take in the hospital and Miller Park Drive and several residential neighborhoods. So it'll be quite an extensive and useful, and we hope well used trail eventually.
Mr. Nunnery, this is Gail Phillips. How much of this is actually completed and available to walk now?
This particular route?
Yeah. How much of it?
Now, there are other trails in town that are completed and or in a planning stage. Of course, notably is the trail, the Trace Pittman Trail that follows the creek. But the one that we're talking about now, the orange line, is now completed, of course, with a new piece of sidewalk that was recently poured. Then if we can complete the trail with the DGA trail across your property, that'll get us to the DOT right of way, just beyond the trees there. And DOT has agreed to it. so all we'll need to do is to excavate and install the DGA, and we'll be that far. So right now, all that's actually complete and you can walk on is really the orange line. So that's
Okay.
the rest of this. We hope to be constructed soon. But
Okay, thank you.
So do we have a motion?
This is Dan. I'll make that motion.
Who made the motion?
Dan,
Okay, so Dan made the motion. Do we have a second?
Dr. Hessen.
I'll second.
Okay. All in favor, say aye.
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 Any opposed? Okay, motion carries.
who made the second? I just want to make sure I got that.
I think it was Gail.
Yeah, okay. Now this is the financial part. I'm scrolling to the bottom where the financial request is that says Taylor County Trail Town would like to request the funding of $15,000 to assist in further support of this. I'll let them speak a little bit about what the 15,000 would be used for.
Okay, this is Suzanne Ince, and I'm happy to answer any questions you all have about this proposal, but we would intend to use $650 of that money toward a Walk with the Doc starter kit to implement that program on the trail system. And then we would request the balance, the $14,350, to be used to make the connector trail through Miller Park from the newly installed sidewalk on Lebanon Avenue, and then connecting to the Trace Pittman Greenway.
Okay. And I guess the board probably won't approve this until we present the budget, but let's go ahead and let them ask questions if they want to.
Okay.
So
Now-
this is Gail again. Forgive me, maps are not my strongest suit. So are you saying that the money that you're requesting would complete this project, all of the blue?
No, I am not. The blue section is currently still in a planning phase. However, once all the easements have been approved, then we could move to construction. But because those are contingent on the new board at Taylor Regional as well as private landowners, we can move forward more readily with the Miller Park project, which has already been planned and has a budget proposed, and it's all city property. So there's no restrictions there on when we could start on that. And so, no, it would be connecting where the orange line begins on Lebanon Avenue and then over to the Trace Pittman Greenway through Miller Park on the lower end of Miller Park, opposite of the walking track.
I'm not sure where Lebanon Avenue is. Is it where the orange line ends off at?
correct.
Yes,
So the trail would sort of start moving back toward where the blue line kind of ends off.
Well, yes and no. It goes in that direction, but if you'll follow with your cursor, at the end of the orange line, stay on Miller Park Drive with your cursor and go on down to 527.
Here's 527. So down this way.
Towards the head of the
Yeah,
Trace.
Miller.
Towards the head of Trace Pittman.
It's Miller.
This way.
Miller Park Drive. Yeah. So when the route that we're going to be able to follow, where the construction of the sewer line will take place, is somewhere between the upper and the lower Miller Park Drive. The pipeline will be coming across just below the intersection that goes up to the subdivision, blank on the name, Warren Place, and will go behind the tennis courts and other facilities down close to the lower Miller Park Drive. So that will be the trail route through the park. Now, once we get off the blue line across your property, we'll be on the DOT right of way. We'll follow the fence line. DOT's already approved this part of it, and come down to the parking lot. We'll exit onto 3350, and then there'll be just a short piece from the entrance to that parking lot. You see the trees down below 3350, which you can follow with your cursor.
I see
Right down in down in that area, there's a parking lot, and the trail will exit onto the shoulder of 3350 to the intersection. We'll turn left and come down to Miller Park Drive, where you would have to then cross 527 to get onto Trace Pittman.
Okay. So the money that you're requesting this time is going to go from the end of the orange that I'm looking at and go down toward the Pittman, Trace Pittman.
Yes, I mean, yes. And the reason, in addition to what I had already stated about the level of readiness of the project, is that in tying it into the Walk with the Doc program, this would easily allow Taylor Regional physicians to begin at the medical park area or the hospital and meet local residents in that area or at the Trace Pittman for a Walk with the Doc program, which Trailtown would help support and administer throughout the fiscal year in support of that. And so, yes, it does help us check mark a connectivity, but it also easily accommodates the area of interest for the program that we're proposing.
Okay, thank you.
This is Greg. I've got a question, Dave. Has estimate been done from the health department all the way down to the walking track on that side of the road? Has the estimate been done what it would cost to tie those two together?
We do have an estimate of a little over $40,000, and I'm not sure the start and the end point for that because when it was made, the new sidewalk had not yet been constructed. Blake did that for some time ago, and so some construction has taken place since then. So it's going to be probably just south of $40,000 to construct what we're talking about, that would not only include the blue line, but would also include construction on down to Miller Park, where it would cross over to Trace Pittman.
Right. I'd assume the plan is still to put the walking track on top of the new sewer line going through Miller Park. Is that right?
That is correct.
So the 14,000, what is that actually broke down to? Is that only for rock, or, I mean, when they lay that sewer line, it looks like to me they should be able to do the surface work.
Yeah, they will through Miller Park Trail. That's not part of the discussion here. I'm just talking about the area from that connects the blue line down to to Miller Park Trail, or down to Miller Park Drive. Now,
John, can you go back to the map?
Sure. You should see it now.
So, Dave, are you saying from the health department down to the walking track? Is that what you're proposing?
Well, the cost that was calculated in August of 2019 included dense grade aggregate, a 10-foot wide path, and we're talking now about 8 feet. We've reduced our proposal in that respect. But at that point, the cost of clearing and grubbing and DGA and grading and so forth was, let's see, just under $30,000 for those three elements. Now, there's also some additional amounts for tile and for benches along the DOT area, which is approximately $11,000.
But you're talking about the grant being from the health department down to where the little B is at the walking track.
No.
Is that the area you're talking about now? For the grant?
We don't see your map up here on our screen right now, but say that again, Greg.
Going from the health department, the lower part of the parking lot, like we've talked to, and going southwest onto 3350 Council Bypass down through there until it hits the walking track. It's up on the hill. Is that the part that you're wanting the 14,000 for?
No, it's not. Greg, this is Suzanne. The proposal includes connecting from Lebanon Avenue, where on your map, the orange line ends and begins on Highway 289, and then going through Miller Park. At this time, if your all's fiscal year and the construction of the water project will probably coincide. So likely this funding could be used to help accommodate funds from the city that will be matched to some degree with that project, because construction will lend itself well to allowing us to use that course for the trail. However, in planning and not knowing the timeline, our master plan includes a trail that connects the lower end of Miller Park as well as the upper level of Miller Park, such as the walking track, the tennis courts, and so forth, and it loops together. So,
yeah,
because the water project is unknown to some degree, we're talking about going from Lebanon Avenue, where the new sidewalk is on Highway 289, and going through the lower end of Miller Park and connecting to Saloma Road toward Trace Pittman. So from the gazebo over to Trace Pittman.
Okay, that's where the sewer line's being laid, the new sewer line down through Miller Park.
Yes, and we've already been assured that the city and the contractor that will be laying that sewer line will give us that DGA surface to use as a trail once that project is complete. So I'm not anticipating any additional cost or expense to us with respect to that portion of the trail that would go through Miller Park.
Yeah. Hey, Dave, I mean, when you reduce that trail from a 10-foot to 8-foot, it becomes non-laneable for bicycle traffic, right?
Well, no, I didn't know that. I didn't know that. So is that a state dimension that's a regulation?
I think it is. I mean, you can look it up. It always was before, but in order to lane it, put a right and left-hand lane on it, I think it needs to be 10 foot, because otherwise you can't have the bicycles pass each other.
Yeah. Would that apply to a DGA surface as well as an asphalt surface? Because
Yeah,
of course we
for
wouldn't
sure.
lane a DGA surface.
But you'd want to
Yeah.
be able to blacktop it later on, or concrete. Actually, concrete would be the best. But, when we went and rode at the one in Lexington, I think all those were 10, weren't they?
Yeah.
But just a thought, something you might want to check on.
I will check that, and I appreciate your bringing that to my attention. Honestly, our thoughts are always about economy, building this, because nobody has a budget for it. And so, we have to do what we can do. But I appreciate your pointing that out. That we will have to consider.
Everything's tight.
And I think that would be important when we have to lay a tile or construct something else that would be a foundation for the trail, so that we have that foundation when the time comes to get it to 10 feet.
All right. Chair, is it all right? Can we move on to the budget presentation and we'll bring this back up when we get to that part of the budget?
Yes, I think that's appropriate. I think we have plenty of information regarding that to be able to make a decision.
All right. So I will move on into the budget presentation. Thank you guys from Trail Town for putting that together. I will add one comment. Tracy texted me and said that last year we approved also some AED machines for I think Campbellsville, was it, Tracy? Let's see, Campbellsville, and they haven't invoiced us yet. So maybe they bought them and aren't going to invoice us, but we'll see. So you should see the budget in front of you on your screen. What we have in this top block, and this is also in your packet, and it'll be on the website after we're done, is this is where we are in our current budget year. This is the budget you approved for our current budget year. The updates are we did, whereas when we approved the budget, it would have given a projected balance, and right now we've got the actual balance through December 31st of where our accounts are. And some of the things that have already been paid have been taken into account, but right now it leaves us projected to end the current year at $458,720.55, which would be the estimated opening balance for July 1 for the budget we're getting ready to approve. We may actually come out a little better than that. We don't always spend all the miscellaneous unknown that you approve, but we expect to be at least at 458,720. So you see that right here at this next block. Funds available at the beginning of next budget year, we're projecting, as I said, at 458,720. Assuming you leave the tax rate at 3.25 cents per $100 of property value, that's this center column. We always add a couple extra columns in case that you want to have some comparative data. But generally speaking, folks approve the tax rate where it is. That's the second column. I can show you at that amount. I'm gonna scroll real quick. I'm sorry if I give you. You can see here, Taylor County, this is how you've actually closed each year for the last several years. So at your present tax rate, you've been closing at a surplus since 2016. So your tax rate seems to be sufficient. So I'll scroll back up to the proposal here. Again, I'm sorry for scrolling so fast. So if you leave the tax rate at 3.25 cents per $100 across the board, it would bring in real property taxes of $356,212.27. The way we arrive at that number is also in your packet. You see we have these calculation sheets that breaks down the property values and the real property, personal property, and motor vehicle. We multiply those tallies by the tax rate and then a 95% collection rate. Where we get the numbers for these calculation sheets is from this worksheet that's sent to us from the Department of Local, I'm sorry, my screen got away from Department of Local Government, from the Finance and Administration Cabinet. This is the same property value estimates that's sent to all taxing districts, including the county and the schools and the libraries or whoever else sets taxes. So we just take the amounts from there, we plug it into this calculation sheet, into the right category, multiply it by the tax rate, multiply it by a 95% collection rate, and then we plug it into these three categories you see up here. So again, the real property taxes would be $356,212.27. Personal property would be $88,214.89. A motor vehicle would be at $52,211.23. Some delinquent tax collections of $10,000. Other taxes, that's the telecommunications tax, $5,191. And a little bit of interest income, $2,429. You can see in the footnotes that the interest is calculated at 0.5% for the money market account. When you tally up all of those budgeted receipts, it comes up to $514,258. When you add that to the estimated opening balance, is funds available of $972,978. What we propose to spend next year is detailed below. You can see the 2.8 cents that each county contributes to the district. That goes into our operational budget, mostly for staff costs. That's $450,393. Under the category of building maintenance and repair, it's mostly routine things from now on. It's landscaping, fall and spring, $1,000, snow removal if we need it, parking lot and sidewalks, $1,000, and miscellaneous unknown. You'll see we have miscellaneous in each of these categories. That's if something unexpected comes up, it gives us some wiggle room to deal with things without having to call a board meeting. So there's 10,000 miscellaneous unknown under building and repair, maintenance and repair. If we don't spend that, we won't spend it if we don't need it. And if we don't, it'll stay in your accounts and add to your opening balance next year. When you tally the building maintenance and repair, it totals $12,000. Furniture and fixtures, seasonal decor, $250, miscellaneous unknown, $2,500 for a total $2,750. Under equipment, generator maintenance, $500, miscellaneous computer equipment. That would include anything from printers to monitors to the actual computers themselves, laptops, anything we have that's computer or computer related. If it fails and we need to replace it, servers or routers or whatever, we've got 10,050 there. Again, that's a category we won't use unless we need it. And then miscellaneous for other equipment issues, 5,000. That totals 15,550. Other expenses, professional services, 1,400. Generally speaking, that would be an audit, and I think everyone's due for an audit next year, if I'm not mistaken. Isn't that right, Ron?
Not everyone, Sean, but Taylor County has always got to do an audit because their receipts are normally over 500,000.
Oh, I got you. So that's for the audit, $1,400. We have to print our audit report and some financial statements and so forth. So that's $600 we have to pay to publish the financial statements on the state website. Dues and subscription for the board, Calbo and KPHA, $1,500. And in case we're able to have an in-person meeting next year, $500 for meeting expenses. That totals up to $484,693 total expenditures. When you subtract that from the funds available, you would end with $488,286, which is $29,500 better than where you began. Below that is the two optional additions to the budget. One of them is the $15,000 Trail Town proposal that was just made. That's option one. And also, there in the building, ever since the building's been built, there's been some problems with the lighting. Shannon can explain this better than me, but there's lights that hang down in the foyer and in the clerical area, and some of them don't work. And the way it's built, it's just going to take somebody to come in and do some repair on that to get that straightened out. That's $12,000. And again, if you need more detail of the explanation, Shannon's researched it deeper than me. The total expenditures, if you approve the two optional items, would be $511,693, which would leave the balance at $433,000. $433,642.82, which would be $25,000 less than your expected opening balance. However, you all generally are doing pretty good, and that would be a lot closer to break even in reality. But financially, you all are pretty sound and could afford these things. So with that in mind, the first thing we have to do, well, let's see if there's any questions about any of that before we get into approving a tax rate. Is there any questions about what we've proposed in the budget?
Sean, this is Gail. Would the lighting not be covered by the miscellaneous, that's in there, general maintenance and kind of thing for the building?
It could be, but we pulled it out as a separate line item because we wanted you all to see it. You know, when we know there's going to be a substantial expense, we want to line item it so that you will know
Right,
what we're
I see.
doing.
Okay, thank you.
Sometimes things come up that we don't know, but sometimes there's things we do know.
I've lost your audio.
Did anyone else lose my audio? Hey, Sean, this is Greg. I can't see it real good, but is the Trail Town requesting that too?
Yes.
Yes, it's under option 1, under the optional expenses, the $15,000 Trail Town.
Are they on the line now?
I'm not sure if they're
Yes,
still.
we're here.
They are.
I've got a question on the trail that you're looking at us to provide some funds with. I don't know. I'm just kind of throwing this out. It seems a little bit expensive if they're going to go ahead and do the finished grade. The only thing that's going to need to be done is dense grade put on top. Are we funding part of the sewer project too?
Oh, no. But there's, we've got clearing and grubbing. We've got grading. We'll have at least 2 tile, I suspect, or some kind of bridging on your all's property and on the DOT property going up along the fence. There will be some drainage.
So this is for the sidewalk going down a hospital property connecting to us.
No, you cut out a little bit there, Greg, but what we're talking about here is the funding for, and this is just partial funding, for the route that will go from the hospital property down to where it connects at Saloma Road. The trail route through the park, that's, the city's going to include that. The DGA, the excavation of the DGA will be part of their contract price. And we've got, that's in the works now. We're waiting for bids from contractors currently. No, actually, we're waiting for recommendations of contractors from our project management, but the next step will be to get the bid. So that'll be part of the bid process on the sewer line. So what we're talking about is the cost of getting from the blue line down to Saloma Road.
No, this is Suzanne, Greg. I think what you're saying is throwing Dave off somewhat. To switch gears, specifically, the proposal is from Highway 289, where the new Lebanon Avenue sidewalk has been completed at the gazebo where it begins and running up to Taylor Regional. Okay, we were going to start there at the gazebo area where that new sidewalk is and go on the lower end of Miller Park to connect over to Trace Pittman. We have a detailed budget.
That's where the new sewer line is.
No. The sewer line will go through a portion of Miller Park, and there will be an upper trail and a lower trail. And we will use what we can to work with that construction to accommodate a loop there. But this specifically is a lower trail that follows along the creek line, goes from that gazebo area, follows the creek area, and goes over to Saloma Road to connect to Trace Pittman Greenway.
John.
Yes.
John,
is that clear,
I
or do you have other questions?
Sean, I think we've spent a lot of time on this, and I think the bottom line is the board needs to come up with a number that we're comfortable giving to Trail Town to help them develop this trail. And so we can keep going through all the details, But I think the bottom line is we need to come up with a number that we're comfortable, if we're all comfortable as a board giving to this project. And so I think we need to move on from that.
All right, you're the chair.
Yes.
So
We just need some discussion amongst the board from what we've been told, if we would like to give some money to that project, and if we do, how much would we like to give to that project? Is there any discussion amongst the board in that regard?
I don't think we usually discuss these with our presenters still present in the meeting.
well,
We'll be glad.
it's an open meeting
Yeah,
unless we go into an executive session. Anyone can listen in. We're live on YouTube too, so it's a public meeting.
Gotcha.
I will say this, Dan, I will say, I think this is consistent with what we've given them over the last few years. I've been on the board a few years, and we typically give them somewhere in that area. If I'm correct, Sean, maybe you can clarify that.
Yeah, we've been
You can
contributing.
drag it out, but I think it's kind of consistent with what we've done each year.
Yeah, we've been contributing to the project each year for a few years to try to help it along.
Yeah.
I don't have any problem with the Trail Town concept. I want to back up a little bit. I think that the lighting in the building would take precedence if we do have to make a decision like that. That's my opinion, but everybody, I mean, I don't know if everybody feels that way.
I think that in the budget, we have enough money to do both, and still do a little better than breaking even. Correct me if I'm wrong, Sean.
No, I think you all are fine from a budget perspective.
So I think that everybody's going to agree to do the lighting. I don't think that's going to be a problem. I think really the only thing we need to decide on, number one, is what's the tax rate going to be, which I assume will probably keep it the same by what it looks like. But then, do we want to give money to Trail Town? Which I think the answer to that is probably going to be a yes. But then, how much is going to be the next question.
I agree. I'll make a motion to keep the tax.
How about we go ahead and set the tax rate and we'll move on to the budget.
I'll make a motion to keep the tax rate the same.
Okay.
I'll second that motion.
Well, let me pause you all for a second. I'll need you to amend the motion because the state just passed a new law and it looks like the health departments are going to be under the compensating tax rate. But the Cabinet of Health and Family Services and the Department of Public Health has taken the position that the law doesn't apply to us. And the Department of Local Government has taken the position it does. And I don't know how that's going to sort out. So when you make your motion, could you say, I make a motion to leave the tax rate at 3.25 cents per $100 of property value, or to take the compensating tax rate, should that be what applies to us? Basically, the compensating tax rate means we would set the rate at the amount to keep the revenue the same. So
I'll make that motion of what Sean just said. Yes.
All right, great.
This is Jay. I will second that motion.
Second by Jay. Thank you, Jay. All in favor, say aye.
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 Any opposed? Motion carries. Thank you.
So the only, well, we usually would have you all sign the tax resolution form, but we're going to have somebody deliver those and get signatures later. The state's adopting a new process anyway, so we have to wait to see what it's going to be as far as getting the signatures, how they want that filled out. The last thing, Chair, is to approve the budget. So it's been presented.
Well, Sean, we still didn't approve how much money we were going to give to the Trail Town.
Yes, that's correct. That's one of the items in the budget. So you can address that as part of.
It's really the only item up for discussion in the budget. Is that correct?
Yeah. Well, you all can question any item in the budget.
Right. I understand. Any discussion regarding that?
I'd like to move that we accept the option 1 as presented with the $12,000 for the lights and the $15,000 for Trail Town.
I'll second that motion.
Any discussion? Okay. All in favor, say aye.
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 Any opposed? Motion carries.
Nothing left to do but adjourn.
Do we have a motion to adjourn?
Thanks to all of you.
Yes,
So
we're so
moved.
grateful. Thank you.
All right. Thank you to everybody. Thanks for joining the meeting. Sean, I appreciate it. Good job as usual. And keep up the good work at the health department. And we need the health department more this year than we ever have, or more in the last year than we ever have. And
Thank
so
you.
I appreciate all the work you've done.
Bye, everybody.
Thanks,
Thanks,
everybody.